Hi everyone. So today I will be discussing a case of a 28-year-old with bilateral knee swelling and ankle pain for over 6 months, and he presented to the OPD for ankle pain to get his ankle sonography done. So the idea of this case discussion is to emphasize the role of MSK ultrasounds, how important they are, and how dynamically you can identify and diagnose various disorders. So this case emphasizes how an ultrasonography can identify even subtle findings. So this is the longitudinal sonographic view of the tibiotalar joint, and here we can see that there is moderate synovitis in the joint, along with osseous remodeling changes in the form of small osteophytes, which are consistent with osteoarthritic changes, and hence we can see the ossific spurs, the synovial effusion, the thickening of the synovium, which is different from the anechoic fluid echogenicity. Okay, as I go ahead and I look at the talonavicular joint, I see mild fluid in the talonavicular joint, and he had these x-rays done before he came for the sonography, and I could see that there is effusion in the tibiotalar joint on both the sides, along with there are intra-articular loose bodies or the osseous bodies and the small ossific spurs which were identified on the ultrasound. On the frontal radiograph, there weren't any changes of reduced joint space right now, but there was joint effusion, spurs, and early OA changes. He also had a knee radiograph with him, which looked normal to me on the first, but then I could see that small ossific spurs along the medial tibial plateau. Okay, and on the lateral radiograph, I could see that there is large effusion in the knee joint, and because he had knee swelling, I was concerned whether it could be an inflammatory or infective arthritis. But having said that, he had a history of 6 months. Infection would be more aggressive and would cause more joint damage. So what do I do next? So the patient is your best friend. He gives you the clues, and if you talk to the patient, he gives you the other findings which he is suffering from. So on reviewing the knee x-ray, I could see that the femoral condyles were wide and broad, and there were early medial compartment osteoarthritic changes in the form of osteophytes and mild genu-varus deformity. And there was a large suprapatellar effusion on both the sides. So I took the patient again on the sonography machine, and I could see that there was large hemarthrosis in the knee joint extending in the suprapatellar recess. These are the transverse images of the ultrasound showing blood accumulation within the joint. And this is the quadriceps tendon showing the fibrillar appearance inserting over the patella. So the final diagnosis was a hemophilic arthropathy with synovitis in the ankle and hemarthrosis in both the knees with OA changes or the osteoarthritic changes. So preventive therapy may lead to less joint damage in hemophilic patients. And as MSK radiologists, we can always, help the patient by identifying various findings like synovitis, destruction of the joint, and the early osteoarthritic changes. And if we give these findings well in advance, we can help patient identify his disorder at the earliest. So it's very important for us to talk to the clinician, talk to the patient, and have all the investigations together at one step.